Hello, my name is Krista Wycinsky. I am a senior in the Communication Disorders Department and I have a minor in gerontology. My poster is about Down syndrome. It has facts about what Down syndrome is, the physical appearance and characteristics of people with Down syndrome, and treatment and support options. So to begin, nearly 6,000 babies are born with Down syndrome each year in the United States, making it the most common chromosomal disorder. As common as Down syndrome is, a lot of people don't know a lot of things that someone can do to help people with Down syndrome. They may be able to recognize someone on the street who has Down syndrome because of the distinct characteristics, which I will discuss here soon, but a lot of times people aren't sure what they should do to support or help those with Down syndrome or those whose families are affected by people with Down syndrome. So here I will discuss some treatment and support options as well as what Down syndrome exactly is to gather some more information. So what is Down syndrome? Down syndrome is a genetic syndrome where the person is born with an extra copy of chromosome 21. About 6,000 babies are born with Down syndrome every year in the United States, as I previously stated. And Down syndrome is not specific to one ethnic group or economic group. Anyone can have a baby with Down syndrome. And while in the past, people with Down syndrome only lived to 25 years of age, now they are living longer than ever. The rate of Down syndrome babies dying in the first year of life decreased from 8.5 to 5% between 1979 and 2003. People are now living up to 60 years of age instead of 25 years of age. And this was solely happened in about 40 years. So what are the risk factors of having a child with Down syndrome? Some of them include the advancing maternal age. So the older the mother is, the greater chance there is to have a baby with Down syndrome. Or if you are carriers of the genetic translocation for Down syndrome, that is also obviously a risk factor. And having one child with Down syndrome increases your chances of having another one with Down syndrome. If you can find out that your baby has Down syndrome before you are pregnant, that gives you a way to prepare for the challenges that may come. Diagnostic tests include chronic villus sampling, which is CVS, amniocentesis, and percutaneous umbilical blood sampling. And there is no way to prevent Down syndrome. If you are high risk at having a child with Down syndrome, consulting a genetic counselor is an option. This is a way to tell if you are carriers for the genetic translocation. And people with Down syndrome vary heavily in cognitive abilities, but all people with Down syndrome may have strengths and talents. They have many of them. They should never be underestimated, and that is the big takeaway I want everyone to have about people with Down syndrome. They are able to get an education, work a full-time job, have meaningful relationships, contribute to society, and have a say in their life decisions. They should not be pushed aside like they don't know what they're talking about, because that is not the case. So as I stated before, a lot of times people are able to recognize people with Down syndrome on the street if you would just see someone, but some typical physical characteristics that you may see is the flattened face, the flattened bridge of the nose, small ears, hands, and feet, low muscle tone, and loose joints, which often contributes to the excessive flexibility, almond-shaped eyes that slant up, a shorter neck, a shorter stature, and as you can see, I have some pictures of individuals with Down syndrome on my PowerPoint, and a lot of times these features could be more prominent in others than they are in others. Sometimes it may be hard to tell if an individual even has Down syndrome. So these features shouldn't be blanketed for every individual that has Down syndrome. Some have others that others don't. And then in addition to the physical appearances that vary, the characteristics vary even greater. There is a mild to moderate intelligence range to every single person with Down syndrome. There can be high functioning or lower functioning people with Down syndrome. And typically, children with Down syndrome are slower to begin speaking than typically developing children. A lot of times, parents of children with Down syndrome will use baby sign language as a means for communicating. This reduces frustration on both parts of the parents and the child. It allows using simple things as thank you or more, allows the child to communicate what they want without becoming frustrated. In addition to being slower to speak, hearing loss is common, as well as ear infections. This can possibly have to do with the fact that they have smaller ears, so they have smaller ear structures on the inside as well. It's very common for people with Down syndrome to have obstructive sleep apnea as they age, and up to 75% of people with Down syndrome are affected. And it's very common for children with Down syndrome to be born with heart defects. Some require surgery and others go away on their own. So right when they're born, they may have to have surgery. A lot of times they will also require eye issues that require glasses. In addition, eye diseases such as cataracts are common and affect up to 60% of the Down syndrome population, and thyroid disease is a common concern as well, but it's not as common as the others. Only 18% of the population of Down syndrome is affected. And now I have some treatment and support options for people with Down syndrome. The main ways to ensure a child with Down syndrome has a fulfilling life include providing them with quality education programs, a stimulating home environment, good health care, and positive family support. These are general things that you should provide to any child, but they really help children with Down syndrome flourish. The Down Syndrome Research Foundation provides families with children of all ages multiple resources. And here I have listed just a few of them. They have many on their website, which I have put in the references. There's a mental wellness service for children and their parents. There is so many different theater and improvisation groups for children with Down syndrome. I also know that there are many ballroom dancing classes or activities that just to get them into the community with other people with Down syndrome. And children with Down syndrome often have a care team of multiple people. This includes physicians, special educators, speech therapists, occupational therapists, physical therapists, and social workers. The physicians are obviously there from the beginning in case they have heart defects, which they will provide surgeons and surgeries for the child with Down syndrome. Speech therapists, this also is for them to communicate more effectively. They can see a speech therapist from the time they are born and getting early intervention until the time they are an adult. And it can just simply affect their speech and how effectively they communicate with others and how understandable and intelligible they are. Occupational therapists help with everyday skills and tasks that may come easier to children who are typically developing, but may be a little bit more difficult for children with Down syndrome. Physical therapists are also there to help build motor skills. And a lot of times, a lot of these therapists and treatments will continue from the time they are born until the time they are an adult. So the main takeaway from my research on children with Down syndrome is that there's a wide variety, and the best way to ensure a happy life for a child with Down syndrome is to make sure that they are supported and have a stimulating home environment. People should never underestimate the power of people with Down syndrome. Thank you.